of stress through physical symptoms that are often manifestation of psychological emotional distress. Having a headache without an underlying cause, uh, numbness of your body without underlying cause. Um, the other day, our patient actually had paralysis of one of her arms without any underlying cause. This is what somatic symptoms mean. My stomach hurts, but there is no underlying medical cause. It's all due to anxiety and stress. This is how somatic symptoms present themselves. Okay, so we're going to talk about STD, somatic symptom disorder, illness anxiety disorder, which is hypochondriacs, conversion disorder, psychological factors affecting medical conditions. Don't worry about that. And factitious disorder, fancy word for Munchausen. I think you guys know what that is, right? Munchausen. You guys heard of that? What's her name? Lily Rose. Have you guys seen that on Hulu? Right? Only one person? Are you guys alive? Let's talk about somatic symptom disorder. Excessive and manipulative thoughts, like extreme emotions and behaviors regarding physical symptoms that significantly disrupt the patient's daily life. So these symptoms can be, excuse me, oh, my head hurts all the time. And they will constantly tell you, and they'll interrupt you, and they'll manipulate any conversation. Oh, my back hurts. My stomach hurts. Please listen to me. Please talk to me. And these symptoms that are maladaptive, okay, have to persist for 6 months. Okay, symptoms last for more than 6 months, significant anxiety, and may not be explained by an underlying medical cause. So, if they say, "Oh, I feel my hands are numb, my feet are numb, my head hurts, my stomach hurts, I have left side or right side weakness," and if this goes on for more than 6 months and there is no underlying medical problem, somatic syndrome disorder. Okay, excessive anxiety and behaviors around symptoms and health concerns. Oftentimes, when you're doing group therapy with your patients and you're asking everyone to talk about their day, before it even comes to this one, to the somatic symptom disorder patient, they will interrupt and manipulate the entire conversation. Okay, tell them to stop. Hey, I understand your back hurts. Let's make sure that Bob is done talking and then you can talk. Okay. So the thing with this is, if they tell you that they're like bugs crawling down my back, or my head hurts and my eye hurts, I feel like it's about to pop, believe them, take it as reality, assess, um, and then move forward. Does that make sense? Even though you know they have somatic symptom disorder, it doesn't matter. Just go ahead and assess them. Okay, assess their vital signs, maybe do some labs, spend time with them. Spend time with them, even especially when they're having their somatic symptoms, because they're probably really anxious during that time. Okay? Does that make sense, guys? What I just said? You guys understand somatic symptom disorder? Illness anxiety. Hypochondriacs. Okay? These guys misinterpret physical sensations. Okay? They're overly concerned and preoccupied with symptoms that can last for 6 months. For example, these guys will get the same test from different doctors. All the results will be normal, but they will think that they have a problem, that they have a disease. So getting an MRI from like 7 different doctors and still thinking you have a tumor. Okay. This is what illness anxiety disorder means. There was this one, I remember watching a show, I don't know if it was Chicago Med or it was some medical show, and one of the patients thought she had cancer, and she would go to all these different ERs and she would get tested to see if she had cancer, and all of them were normal. And this persisted for a year. Okay. illness anxiety, extreme worry, high anxiety about health, excessive health related behaviors, or maladaptive avoidance. Okay. I think COVID has kind of instilled a sense of illness anxiety in a lot of people. Don't you guys think so? No? Definitely, right? I have a lot of people who are my non-nursing friends message me all the time. My throat itches. Am I okay? Should I go get tested? I coughed. Everyone's becoming a hypochondriac because it's just insane what's happening, right? And it's all of us, right? And this has been going on for like, when did it start? 2020. It's gonna be 2022 soon. Yeah. Conversion. This was kind of cool. So this is where your patient randomly gets blind or paralyzed or becomes like a statue. Okay? Can be walking down the hallway and all of a sudden he's just like paralyzed and frozen. And they can get blind. Okay? Numbness. They'll lose their hearing, their vision, or they'll just randomly have epilepsy. Okay? The actual diagnosis behind all of it is anxiety because it's unexplainable. There's literally no neurologic symptoms behind or neurologic evidence behind why this happens, because they will get their eyesight back and then their paralysis will go away. They'll get their hearing back. It's kind of interesting. And the interesting part is that they're very indifferent to all of this. Label indifference. Okay, they just won't do anything. If they become blind all of a sudden, they'll just sit there or stand there. So your nursing intervention is, okay, let's get you in a wheelchair. Let's take you back to your room. Okay, you kind of assist them with all of this. If they have like paralysis of one side, you kind of walk them back to their room or walk them to a group or wherever they're going, because they really won't ask for help. They're unconcerned with symptoms caused by a conversion disorder, a naive, inappropriate lack of emotion or concern regarding the seriousness of the illness. Insane, right, guys? I think it's insane. Like, if God forbid I get paralysis of whatever area, I'll freak out and I'll scream. These guys, this doesn't happen. Physical symptoms relieve anxiety, and they're resistant to accepting help. Yep. Factitious disorder. Factitious disorder. Munchausen. I believe you guys know this as Munchausen, right? You guys heard that? So, voluntarily, deliberately, artificially, dramatically fabricating symptoms or self-inflict injury. Okay? Their goal is to assume the sick role or to make someone else sick. She's still in prison. You guys know what I'm talking about, right? Gypsy Rose. She's still in prison. I think she even had like an interview. Oh my God. I think she recently had an interview that was televised because she killed her mom, because she imposed all this. Right? They're very compulsive people. So it's kind of broken down into three. So Munchausen by proxy, and the lingering. The one with the movie, yeah. It was really cool. I loved it. So Munchausen, factitious. So these guys have a long history. They'll come to the unit, they'll come to you, whether it's outpatient or inpatient, and they'll tell you a bunch of stuff, okay? Lists and lists of diagnoses, lists of meds, and it'll be inconsistent with what you assess. So what you assess and the exam findings you find don't match with everything they're telling you, okay? So the way these guys get diagnosed is you catch them in their deceitfulness. You catch them hurting themselves, falsifying, like you catch them red-handed, okay? And what's crazy is that there's literally no underlying factor to why they have this disorder. There is no like comorbidity or like underlying issue. Does that make sense? It's just, this is it. Factitious disorder. It's kind of insane. Attention seeking. Then we have by proxy, it's Gypsy Rose, right? Not Lily Rose, Gypsy Rose. What her mom did. Someone else doing it too. Your parent, your guardian, okay? Often directed, imposed on others. So deliberately cause injury or illness to a vulnerable person. Okay. And they get a whole lot of stuff for this. What did the mom get? Like a house, money, what else? Attention, um, everything. Free care. She got everything for making her daughter sick. Okay. Um, yeah, this is it. This is the worst thing that can happen to you. A lot of the times, I haven't come across this, but my friend has. And what happened was basically they caught the parents inflicting some. I think they purposely dropped the child to the floor. That's what they were doing. Munchausen. So you see this a lot in the ER. You see this a lot in the ER. So it's kind of interesting. Malingering. So this is kind of different. Malingering is it's different. So patients are externally motivated. So secondary gain. So insurance fraud, right? Um, Disability benefits. It's writing uh, more things onto your disability list so you can get more benefits, more money. um, Saying you have some form of disease or disorder so you can avoid military service. Prescription meds. A lot of patients come in and say, "Oh, I'm in pain. I'm anxious." So they get more benzos and more opioids. So there's a secondary gain, more attention, more benefits, more money, and you get out of unpleasant responsibilities. Okay, does this make sense? These are the people who get caught, and you see it on the news. This is this. This is malingering. Again, go over these. We don't necessarily learn this anymore, but it's good to know. Pain, anxiety, risk for loneliness, powerlessness, hopelessness. The most important thing when you're caring for somatic symptoms is accept these symptoms as being real. Okay? Everything they're telling you, take it as the truth. Assess them. Even though you know it's probably not real, assess it. Okay? Obviously, you're assessing for SI always and forever. If they're malingering, secondary gain. Um, every time they report a new physical manifestations, that's if if their somatic symptom has always been my back hurts and now they're telling you their eye hurts, okay, report it to the doctor, document it. If they're manipulating the conversation between you and other patients and they're constantly talking about their somatic symptoms, limit. Tell them to stop. Okay? Provide relief from health anxiety. There is no specific med approved for this. We treat whatever they're reporting, whether it's pain, whether it's anxiety, so benzos, pain meds, behavior, that's all we're treating. Okay? I don't really dive into this slide, but this is kind of self-explanatory, right? Establish therapeutic relationship, make sure they're safe, trust, physical care, try not to enable them, encourage them to talk about their feelings. Cognitive behavioral therapy, assertive training. Okay, this is all about stress and anxiety, so you kind of have to reframe how they think. And again, so benzos for anxiety, obviously we use them with caution, and antidepressants if we have to, right? If there's an underlying depressive issue, but there is no specific approved med for this.